Okay. Welcome, everyone. Good afternoon. Thank you so much for joining us today. My name is Anne Marie McGrory, the Director of Communications at the Stoneleaf Foundation and the technical producer for today's event. Before I turn things over to our speakers, please know that we will be setting some time aside at the end of today's discussion for audience questions. If you have a question for any of our speakers, please use the Q&A button on your screen to type and submit your question at any time. Please include your name and organization with your question so that we can identify you for the speakers. Now I'd like to turn it over to Michael Ampere of the Center for Youth Justice. Thank you.
Thanks so much, Anne Marie, and good afternoon, everyone, and welcome. As Anne Marie mentioned, I'm Michael Ampere, Director of the Center for Youth Justice at the McCourt School of Public Policy at Georgetown University. And it's my pleasure to open today's webinar, Improving Outcomes for Youth Involved in Multiple Systems of Care. I want to begin by thanking all of you for joining us. We have folks from all around the country with us today, as well as our partners at the Stoneleaf Foundation and all of the state and county leaders, researchers, and practitioners in Pennsylvania who have made the Pennsylvania Multi-Systems Integration Pilot Program such a groundbreaking effort. At the Center for Youth Justice, we have been deeply committed to supporting cross-system collaboration on behalf of young people and families since our founding in 2007. We know from the research and from our own experience that the challenges that young people and their families face in this country are often multifaceted and they're complex. And yet, too often, the systems that are charged with responding to these challenges, whether it's youth justice or child welfare or behavioral health or education, attempt to do so in isolation. And from the start, our center has worked to bridge those divides and to promote integrated approaches that put young people and families at the center of the work. A key example of our efforts at the center is the Crossover Youth Practice Model, or the CYPM, which we developed in 2010 to strengthen collaboration between the child welfare and youth justice systems and related systems of care, and has now been introduced in over 120 communities across the United States. The CYPM is backed by research, and it's been recognized by the National Institute of Justice, the Office of Juvenile Justice and Delinquency Prevention, and the California Evidence-Based Clearinghouse for Child Welfare as a promising program that improves outcomes for young people and families who touch multiple systems. The MSI work in Pennsylvania that we'll hear about today builds upon this foundation of the CYPM, and it builds upon the foundation of the Pennsylvania Care Partnership, which, as many know, is an outgrowth of the nationwide system of care body of work. These efforts have been grounded in core principles of cross-system collaboration. They've been grounded in principles of data-informed decision-making and youth and family-centered practice. And what's happening in Delaware County, Pennsylvania in particular, as we'll hear about today, represents an exciting evolution of this approach, demonstrating what can be achieved when leaders truly commit to working together across system to meet those complex needs of young people and families. And I'm thrilled today that we have the opportunity to dive into some of the lessons learned from this work, some of the results emanating from the great innovation on the ground. So with that, I'm pleased to turn things over to my colleague and the founder of our center and Stoneleaf Fellow, Shay Bilchek, to provide an overview of the session and to get us going today. Thanks again for being with us all.
Thanks, Michael, and thanks to the Center for Youth Justice, the Stoneleaf Foundation, and Delaware County, as well as Erie County, that also participated in the MSI pilot program for your partnership. This has been a tremendous effort, one that took place during the pandemic, adding to the stress that starting any new project would entail. So I thank both of those counties for their efforts to find better ways to meet the needs of the children they serve. This is the third webinar in a three-part series designed to focus on the development and implementation of the Multi-Systems Integration Pilot Program, or MSI as we call it. Parts 1 and Parts 2 explored the research on the multi-system population of youth upon which the MSI focuses, their characteristics, the correlations related to their multi-system involvement, the historical efforts that have been undertaken to address them, efforts like system of care and the crossover youth practice model, and the steps taken in Delco and Erie to implement the MSI, a more comprehensive and holistic approach to meeting their needs. We are inserting the link to those first two webinars in the chat box so you can see them and access them if you're not able to previously participate in them. Today's webinar is divided into 4 parts. This introduction, which will include some nuts and bolts on the development and implementation of the MSI. A second part focused on the data findings that resulted from the implementation in Delco, Delaware County. A panel discussion with 5 leaders from Delco who were involved in that implementation, and last, a time for questions. In that regard, please enter your questions, as Anne-Marie indicated, in the Q&A box throughout the course of the webinar, and we will do our best to answer them before we adjourn. Now, turning to the next slide, we begin to look at who will be presenting today. I'm here with Michael and Pierre to start off. The next section will be done by Dr. Meg Ogle and Keisha Brown. Keisha is the Data Statistics and Quality Improvement Administrator at Delco's Human Service Office of Mental Health. And then Meg is currently with the Pennsylvania Juvenile Court Judges Commission. But at the time that she was working on this project, for the most part, she was also a Stoneley Fellow, an Emerging Leader Fellow. So it was great that she was able to be involved in this project. On the next slide, we have the presenters highlighted who will be constituting the panel. All 5 systems and the judiciary are on this slide. Jeremy Curtis in education, Melanie Govan in juvenile justice, Laura Kubler for the Office of Mental Health, and Gretchen Sidler representing child welfare. Judge Kroll also is on this slide, and she is doing her best to be with us during the broadcast of the webinar. She is on the bench. She is overseeing a jury trial and hoping to take a recess in time to be part of that panel when it's queued up during the course of the webinar. Then on the last slide, as indicated, we'll be hearing from Ronnie Bloom, the Executive Director at the Stoneley Foundation, with her concluding thoughts about this body of work and Stoneley's involvement. So moving to the next slide. As Michael indicated, the MSI brought together the evidence-based system of care with the crossover youth practice model, 2 approaches proven to be effective. And the hope was, as reflected on this slide, that through enhanced multi-system policies and practices, we would see improvements in system-level operation and then ultimately population-level outcomes in child welfare, juvenile justice, behavioral health, and education. That is that more holistic involvement of bringing those 2 efforts together that would go and satisfy the goals of the program. On the next slide, we see exactly the process of site engagement looked like. The development of a governance structure, the leadership team, the implementation team, work groups that would carry out the work to develop new policies and practices, the completion of the rubric of policy and practice domains, identifying current gaps that exist that the county wanted to address. I'll talk more about that rubric in a few slides, but it was developed by Dr. Denise Hers and Dr. Carly Durkheising at Cal State University in Los Angeles as a way of identifying the most effective ways of doing this kind of collaborative multi-system work. Another aspect of the site engagement was the development of those new policies and practice protocols, information sharing MOU about how information sharing would be enhanced appropriately, respecting the privacy interests of the parties, including developing, as needed, new information sharing consent forms. The training of staff in partner organizations, but also the utilization of cross-system training that each agency would do as part of the Delco effort. The development of the baseline pre-pilot and pilot data collection, and then analysis methodology. And we've covered some of this in the prior efforts in webinar 1 and webinar 2, but today we're going to focus largely upon the data construct and focusing, again, significantly on the pilot data and outcomes that we saw as a result of the implementation in Delco. Then the launch of the MSI pilot program, utilizing those protocols, the information sharing MOU, and then ultimately, as I think Keisha will touch on, the development of quality assurance tools that are designed to help sustain the new policies and practices. Now, going to the next slide, we describe briefly the training and technical assistance that we offered, which was the kind of personalized, jurisdiction-specific, no cookie cutter here. What Delco needed would be what we would try to design and present in the context of the needs that they identified that they needed to have strengthened or codified or routinized. Time-limited ongoing work groups assisting them in the implementation in identified areas, and there's some examples on the slide. Both on-site and virtual meetings with the leadership and implementation team and work groups. This was a key part of at least having monthly calls, phone calls. In Delco, they were 9 minutes long, as well as on-site meetings. There were several of them that took place during the course of the engagement where Meg and I traveled to Delaware County and participated in day-long meetings with the leadership and implementation team and cross-system partners. As requested, we would hook up the sites with CYPM sites and system of care sites for advice, and then active support in data collection and analysis, measuring the impact of the pilot program. And that is an ongoing effort. When I talked above about time-limited workgroup activity and ongoing workgroup activity, that data workgroup was the long-lasting workgroup that we needed to involve to make sure that we were not just implementing something new, but tracking to see whether it was actually being implemented as designed and then having an impact, those outcome measures. We're focusing today largely on Delco because they were able to really track in the implementation phase whether the system changes that were adopted actually were implemented. And they tracked that implementation in a way that we could then correlate the ultimate outcomes. And you'll see this when Dr. Ogle and Keisha Brown do their presentation. So that was a key part of what we did. On this next slide, I've foreshadowed the rubric, and we were, just so happy when Dr. Hers and Dr. Durkheising were able to develop this because it was based upon an analysis of the research, a close scrutiny of the site work that was done across the country in the crossover youth practice model to identify what are the things that seem to be most salient in leading to effectiveness in doing cross systems work. Now, on this slide, we have two aspects to it. On the left is what I call infrastructure, what needs to be in place in terms of the context for doing the work, and then on the right, the operational side. And you can see what these elements look like, but each one of them is designed or identified as a key aspect of successful work in a cross-systems methodology. I added two bullets on the left column, the culturally competent and responsive services and youth and family voice, because those are key elements and values of the system of care work. And we felt that while other things here also reflect system of care, those two pieces needed to be added to build on the work that Hers and Durkheising had done. So again, I'm not going to go into great depth. In a prior webinar, we discussed these at length, but I just wanted to make sure we touched on them today. And then this next slide briefly makes the point about how important it is to do this work in the entire continuum, that we can't think about dually involved children or crossover children, a multi-system involved in youth involved in the multiple systems as deep end involvement. So what this slide tries to do is to present that continuum. In the top left quadrant, a child involved in voluntary supervision, prevention, and a child involved at the same time in juvenile justice diversion also need the kind of cross systems case assessment, planning, and ongoing management to ensure that their needs are met holistically. And then you can read each box about the different status they might be. Below, behavioral health and education always need to be at the table. And then the process from identification of multi-system involvement through the aligned assessment, coordinated case planning, and ongoing coordinated case management. So again, I'm not going to dwell on this, but I wanted to mention it, and it's something that we discussed in more depth in a prior webinar. And these next two slides, what I'll close with, were the steps that were taken in Delaware County. Very similar to Erie County, just a slightly different timeline, where with the first leadership and implementation team meeting in the winter of 2022, moving through the gap analysis with the completion of the rubric, beginning the baseline data collection and moving into ongoing data collection, identifying the target system improvements from the rubric, and to begin implementing them and developing it along the way. And then the next slide, the steps taken in 2023 and 24 were completing the data collection for pre-pilot program youth, That was done in the fall of 23, continuing to implement the target system improvements and begin data collection for pilot program youth, tracking them all the way through the fall of 2024. And then finally, in Delaware County, we sought the input from stakeholders. So Meg and I held discussions with a variety, over 30 stakeholders who were involved in the implementation in Delco about their impressions of the implementation, the impact it was having, how they looked at the benefit of doing it and some of the challenges of doing it. And we'll be covering some of that in the final report for Delco, which has been submitted to both Stoneleigh and Georgetown and will be posted for people to take a look at, to get a sense of the in-depth analysis of what was done in Delaware County and the great benefit, I believe, that the children and families received as a result of that. So with that, main goal of this webinar was the data, but you have a little bit more of the backdrop now. I'm going to turn it over to Keisha and Meg to take us through that journey of understanding the outcomes in Delaware County.
All right. Good afternoon. Can you guys hear me? Hear me pretty well? Okay, great. So Dr. Ogle and I will discuss the data analysis and findings related to the MSI project. Next slide, please. So we're going to share information centered around 5 different areas, which include the data work group formation, the data collected, what we know about crossover and MSI youth in Delaware County, what changed in terms of case practice for crossover and MSI youth between the pre-pilot and pilot periods and over the course of the pilot period. We're also going to discuss 9-month outcomes and how they improved for the pilot youth compared to pre-pilot crossover and MSI youth. Next slide, please. So 3 points I want to just provide. Given the focus of the project in May of 2022, it was critical that we had representation from all 4 systems, which included juvenile probation, education, child welfare, and behavioral health. In addition to system representation, having representation for quality and data analytics was also essential. This is where my experience with quality improvement and Dr. Ogle's experience as a research analyst aided the project. The purpose of the data work group was to provide data management to collect, analyze, evaluate, and remedy any data integrity issues. A significant amount of communication was held via email and through standard monthly meetings. The data work group was also an opportunity to learn about systems I personally had not engaged with prior to the pilot. Also, an opportunity for space to engage in continuous quality improvement around programming and data collection. Next slide, please. I'm going to talk a little bit about the data collection process, including the identification of data and data sharing. Initially, we wanted to define the population, including crossover youth and multi-system involved youth. Crossover youth, as you'll see in the slide, was a youth simultaneously served by juvenile justice, child welfare, and education. So the 3 systems. The MSI youth was defined as a youth simultaneously served by juvenile justice, child welfare, education, and in need or receiving behavioral health services. Behavioral health initially was defined by claims data, which included authorized services. This definition was not inclusive of the various ways youth receive behavioral health services. Services could be assessed for or provided through CYS, child welfare, juvenile court, residential providers. Youth could be on a wait list or refusing recommended behavioral health services. We can capture the need for behavioral health earlier in the case and try to obtain or refer or reconcile issues to get the youth into treatment or non-treatment services, which can include pro-social services. Let's discuss the MOUs, the Memorandum of Understandings. The use of MOUs documented the expectation of early contact and communication agreed upon by both child welfare and juvenile court for all shared cases. The expectation that early engagement of each system is most beneficial to youth and family. The MOUs require juvenile justice and child welfare to cross-check for simultaneous involvement and assess for behavioral health needs early in the case review. Once a youth is identified as crossover or MSI, the data lead is notified, and the youth's information is added to a shared Excel file in a password-protected SharePoint, a location to which both juvenile probation and child welfare had access. Sharing data was a critical piece of data collection. We used a collaborative Excel workbook, as I mentioned, which was both a gift and a curse. A gift in that the data work group was able to complete data entry and review data as needed. Also a curse because the data work group was able to edit data, which, if you're not a data person, sometimes can cause accidental deletions, additions, and errors. These issues must be resolved to ensure the integrity of the data. With the support from research analysts at the time, Dr. Ogle, we were able to maintain a high standard of data integrity. It is important to note data was only shared with Dr. Ogle after being de-identified by myself, the data lead. And then lastly, there were several data fields proposed by Georgetown for the project. After due diligence, we modified the data fields. Collaboration with Georgetown provided flexibility so we could move forward with a data collection plan that worked best for Delaware County. Next slide, please. We're going to talk about some of the data collected, starting with the data types. In 2022, we collected baseline data to gain a better understanding of the demographic representation of youth in general served by each system prior to the start of COVID-19 or the COVID-19 pandemic. We could then compare that information to the demographics of youth identified as crossover or MSI to know whether certain demographic groups are overrepresented in these special populations. For example, if 30% of youth served by each individual system are Black, but 70% of crossover and MSI youth are Black, then we would know that Black youth are overrepresented in the crossover and MSI populations. We then also collected pre-pilot data from 2018 for 51 youth to gain a better understanding of crossover and of who crossover and MSI youth are in Delco and how these youth fared 9 months after beginning multiple system involvement. We wanted to learn from each system's perspective prior to the pandemic and prior to implementing the MSI pilot. This data was necessary to track changes in crossover and MSI youth outcomes 9 months after multiple system involvement that may be attributed to changes in multi-system collaboration and case planning brought on by the MSI pilot. Because pre-pilot youth were followed for 9 months after their MSI identification date, the date that the last system was entered, the data had to be taken from a time period that would not include any impact on case practice caused by the onset of COVID. The pilot data points collected for 46 youth mirrored the pre-pilot data so that differences in outcomes between the two time periods could be identified. Tying these differences to the pilot would require additional information about how case practice has actually changed during the pilot. This was measured quantitatively through meeting data, and additional context was collected through conversations with more than 30 stakeholders who experienced the changes resulting from the implementation of the MSI protocols. Meeting data was necessary to document empirically that the meetings were taking place, the anticipated parties were being invited, and whether they attended. This information can be used to explain observed changes in the outcomes between the pre-pilot and pilot periods. For example, if education is attending more of the pilot meetings than the pre-pilot meetings, and we observe increases in the academic functioning of crossover and MSI youth, this positive educational outcome may be attributed to, at least in part, to education's attendance and participation in the case planning process. During the pilot phase, the leadership team and the Stoneley Foundation determined that capturing meeting data would be beneficial to monitoring the impact change resulting from the MSI pilot program. The pilot captured 9 data fields, including a few I mentioned previously. To show any changes to the practice and compare outcomes, it was necessary to capture pre-pilot meeting data as well. Pre-pilot data was captured from case notes written by juvenile justice in 2018. While the data was limited, we were able to define joint meetings as at least 2 systems verbally speaking to one another over the phone or in person about the youth's case. As you can see from the meeting data, there was a clear difference in the number of meetings. And you'll see all if you under meeting data, bullet number 4, all attendees to 57 cross-system discussions held for 51 youth. In the pilot, all invitees to 222 monthly team meetings held for 46 youth. So clearly, a huge difference there. Some of this difference may be due to the different data collection methods employed. However, conversations with stakeholders suggest meeting frequency has increased between the pre-pilot and pilot periods. The discussions with stakeholders added additional context to these quantitative data points. We learned more about various attendees' participation in the meetings and follow-through with identified action items, and how, if at all, this changed between the pre-pilot and pilot time periods. Next slide, please. Some examples of key data points. Through this slide, we want to provide a snapshot of the type of key data points collected. In total, there were over 300 data points collected for the pilot program. What you are seeing on this slide is just a sample. The slide that follows will provide other data points, but again, they will just be a sample. Before delving into these key data points, we want to discuss the benefits of including data from each individual system. Including data from each system shows impact to policies, processes, and the level of collaboration, exemplified by improved staff experience, knowledge, expectations, and planning. We wanted to show impact to cross-system knowledge and cross-training opportunities. We wanted to, just in reference to the data points shared on this slide, we're showing specific system impact to youth and family outcomes. Some of the outcomes tracked included, as you'll see for juvenile justice, was the youth placed in pre-adjudication secure detention. Child welfare was the youth involved in pro-social positive youth development programming. And for behavioral health, alcohol or drug use at crossover MSI identification and 9 months later. In addition, through meeting data, we were able to show the impact to family meetings, attendance, family case updates, in the hope to create less of a burden on families and a reduction in paperwork. Some limitations to the behavioral health data. Behavioral health data limitations included the data lag, which is providers submitting claims for services after the service has been completed, and that could take up to 90 days. Not providing a level of engagement in the service, so that the claims data does not provide us information on actual engagement, actual attendance, or symptom improvement, such as like trauma and different things like that. Behavioral health data like this is provided through providers and member level documentation, which was not easily accessible due to the vast number of services, providers, and various system funding across systems. Access to this data continues to be a point of discussion. Next slide, please. In reference to the education data collection, in reference to the education data collection process and data points. Education data is collected, or should I say for this project, is collected by the data lead or juvenile probation staff. Juvenile probation identified the school the youth is currently enrolled in. The school the youth is enrolled in is contacted with a release of information collected by juvenile probation, requesting the relevant education data fields for the purposes of MSI coordination and collaboration. Education data access, collection, and sharing was a little more complex. In 2022, the consultants and Delaware County staff engaged the superintendents regarding the MSI project via email, in face-to-face meetings, information sessions focused on how the MSI approach would benefit education partners, families, and youth. To provide some perspective, Delaware County has 23 school districts and 111 schools covering about 70,000 students. 40% of the MSI youth identified for this study were covered by 2 school districts that agreed to participate in the pilot. Juvenile court and child welfare had access to some education data and education context, which made this area of data collection easier. In addition, the MSI team updated and expanded a list of education contacts, resulting in easier coordination and meeting participation with all school districts. One of the challenges we face and continue to face is data collection and sharing related to this population of youth, how to do so without overburdening our current program staff with additional roles. Some of the key, now Dr. Ogle is going to share additional data and outcomes related to the MSI project.
Thank you, Keisha. Good afternoon, everyone. As Keisha mentioned, I'm going to walk us through what do we know about crossover in MSI youth in Delco, what's changed in terms of case practice, and how have 9-month outcomes changed between the pre-pilot and the pilot periods. Just a note on statistical significance before we jump into these results, because not everyone is a data person. Just in general, how statistical significance should be understood. About 95% of the time, the difference or the relationship that we're seeing on the slide is a difference or relationship that exists in the real world. It's not a statistical artifact. That 95% bar is somewhat arbitrary. It is social science standard, but it is somewhat arbitrary. So we have presented not statistically significant results, but that's noted on the slide as well. But that way you can just see where things are trending, even if they don't hit that somewhat artificial bar. So the first thing that we learned is that girls are overrepresented in the crossover and MSI populations relative to their proportion of youth referred to juvenile justice. Since girls have higher crossover and MSI population representation, both juvenile justice and child welfare need to be sure they are meeting the needs of these girls before they cross over or become MSI. The baseline data, if we look at the last two columns there on the right, shows that girls are underrepresented in the receipt of behavioral health services. If girls are in need of behavioral health services and not receiving those services, that may lead to behavior that pushes them into crossover or MSI status. Thus, ensuring availability and access to behavioral health services functions as both a prevention and an intervention strategy. Next, we found that Hispanic youth are overrepresented in the MSI population relative to their proportion of youth in each individual system of care. Given that both in Pennsylvania and nationally, Hispanic youth are the most rapidly growing population of youth of color, it will be important to attend to the unique context and cultures of Hispanic youth and work to ensure that appropriate services are in place to try to prevent multi-system involvement going forward. Additionally, we found that Black non-Hispanic youth are overrepresented in the crossover population relative to their proportion of youth in the child welfare system. If we look at the last four columns in the chart, we can also see that Black youth are overrepresented in each system of care relative to their proportion of the youth population in Delco as a whole. Looking at where the crossover and MSI populations are concentrated within the county, we found that the most common zip codes are 19013, 19082, and 19061. These are all border zip codes in the county. After reviewing census data and the 2025 Children First report for Delco, the following appear to be correlated with high concentrations of crossover and MSI youth: a lower median household income, lower median gross rent, lower home ownership rates, a lower percentage of residents with a bachelor's degree or higher, and higher rates of poverty. The three school districts identified in the 2025 Children First report as needing the most additional funding to adequately educate each student were all in the top 7 school districts with the largest proportion of crossover and MSI youth. These areas of the county need additional funding and services to counteract the lack of supports that are typically found in low socioeconomic status communities. Looking next at how youth travel through different systems to become crossover MSI. Nationally, we tend to see that more crossover youth begin in the child welfare system and transition into juvenile justice. However, in Delco, the reverse is true. It is more common for both crossover and MSI youth to transition from juvenile justice into child welfare. In our discussions with stakeholders, various stakeholders voiced frustration with the fact that even after multiple child welfare involvements, the permanency and well-being needs of the youth and families that they serve were not being met. In fact, about 3/4 of crossover and MSI youth have at least one prior referral to child welfare before being identified as crossover or MSI, and have spent an average of 19 months, a median of 6 months, involved with child welfare prior to their identification. For youth whose pathways start with child welfare involvement, this indicates an opportunity to try to identify as early as possible any risk factors that may lead to crossover or MSI status. It also suggests an opportunity to reevaluate how dependency cases are closed and ensure that they are open long enough that the permanency, safety, and well-being needs of the child are being met. Additionally, we found that MSI youth are, on average, significantly younger at the time they are first referred to the juvenile justice system than the typical youth who's referred to the juvenile justice system. Since MSI youth are younger at the time of their initial entry to the juvenile justice system, it is important to ensure that they have access to behavioral health and other supportive preventative services. Although not statistically significant, crossover youth were also younger on average at their first referral to juvenile justice. Looking at why crossover and MSI youth are referred to the juvenile justice system, we found that a quarter of cases were referred to juvenile justice for a serious violent offense at the referral closest to their identification date. We considered offenses such as aggravated assault, robbery, and rape as serious violent offenses. Simple assault and terroristic threats were not included, since although violent in nature, their misdemeanor status speaks to the lack of severity. So in general, crossover and MSI youth, the majority of the time, are not being referred to the juvenile justice system for serious or violent offenses, despite being complex cases. So unless public safety concerns dictate otherwise, the complexity of these cases needs to be dealt with through greater coordination in case assessment planning and ongoing care management, rather than deeper penetration into the justice system. Next, we looked at stable contact with parents or pro-social adults and involvement in pro-social programming and positive youth development activities. We collected this information from both the perspective of juvenile justice and child welfare at their intake closest to, but not after the youth identification as crossover or MSI. We found that the majority of crossover and MSI youth have stable contact with their parents or pro-social adults at the time of identification. However, most crossover and MSI youth are not involved in any pro-social programming or positive youth development activities at identification. There were no statistically significant differences between crossover and MSI youth on either of these measures. And taken together, while having stable contact with pro-social adults is a positive observation, the lack of involvement in pro-social programming and positive youth development activities undercuts that key protective factor. Next, we found that about 2/3 of crossover and MSI youth have an individualized education plan or an IEP at the time of identification. While this is relatively consistent with national data as to the representation of IEPs in the crossover population, this is higher than the prevalence of IEPs in the general youth population, and thus it highlights the need to ensure that the IEPs for crossover and MSI youth are being followed. We found that 44% of crossover and MSI youth have reported academic problems at school. We did not collect the necessary data to say whether 44% is a high number, but it may be higher than you would expect from the typical youth population. The reasons for this may include a lack of stability in school placement. In fact, we found that about half of crossover and MSI youth were in a different school 9 months after identification. This could also be due to associated challenges in keeping up with their academic assignments and performance, trauma associated with abuse and neglect, and behavioral incidents in school leading to suspension. We also found that a significantly greater proportion of crossover and MSI youth that have academic problems at school are Black. The higher rate of academic problems among Black crossover and MSI youth may be explained, at least in part, by the incongruity between youth enrolled and the teachers, particularly in the 2 school districts with the greatest concentration of crossover and MSI youth. While the baseline data showed that 36% of youth enrolled in those 2 school districts are Black, data from Research for Action shows that only 1 to 7% of the teachers in those school districts are Black. We know from prior research that Black students tend to perform better academically when they're taught by Black teachers. This could be due to teachers' ability to serve as role models, mentors, advocates, or cultural translators. Next, we found that most MSI youth accessed psychiatric outpatient services prior to being identified as MSI. Just a quick note here, any of the behavioral health measures are only going to relate to the MSI population, since by definition, if a youth was in need of behavioral health services, they were classified as MSI. We also found that MSI youth appear to be overrepresented in cannabis-related disorder, disruptive mood dysregulation, bipolar, oppositional defiant, and conduct disorder diagnoses relative to the general population of youth receiving behavioral health services in Delco. And this data highlights the fact that the MSI population has an ongoing need for behavioral health services, and ongoing analysis should ensure that such services are available and accessible to this population. That's a brief overview of what we've learned about crossover and MSI youth in Delco. Next, we're going to review what has changed in terms of case practice. Starting with stakeholder impressions. First, we heard that communication and information sharing about crossover and MSI youth cases has increased. Stakeholders indicated that not only a greater volume of appropriate case planning information was being shared, but the communication across system partners was happening with greater regularity and frequency than had previously been the case. There was also greater attention to the youth and caretakers being at the center of the conversation and a focus of the team on their needs. We heard that there was increased collaboration between systems. Stakeholders described a greater familiarity with their cross-system partners that has led to more collaborative case planning prior to court and greater involvement of youth and their caretakers in the case planning process. Next, we heard that the MSI program should continue, and overall it has been helpful with improving the quality of case planning and management for multi-system cases. Stakeholders acknowledge greater familiarity with the services and policies of their cross-system partners and indicated that the consistent monthly team meetings allowed for a more holistic understanding of the youth and their circumstances, which helped to more efficiently guide the case plan. And finally, we heard that there is a need for continuing knowledge building, i.e. training and mentoring for key partners on multi-system shared case practice expectations and the monthly team meetings. As Keisha mentioned, in addition to our discussions with stakeholders, we did collect empirical data to be able to demonstrate quantitatively what's changed. So first, we found that the proportion of crossover in MSI youth who received joint coordinated case planning increased significantly between the pre-pilot and the pilot periods. Now, it wasn't only the case that a greater proportion of youth were receiving joint coordinated case planning. On average, the number of joint case planning sessions increased significantly between the pre-pilot and pilot samples. And additionally, the proportion of expected crossover in MSI meetings that were held on average was significantly larger among the pilot youth sample than the pre-pilot youth sample. In addition to this difference between the pre-pilot and the pilot time periods, we also saw an increase over the course of the pilot period in the percent of expected monthly team meetings that were held. Turning next to the individual stakeholders that were invited and attended each of these monthly team meetings, this is just over the course of the pilot period, we saw an increase in invitations for youth at these monthly team meetings over the course of the pilot period. At the same time, we also saw an increase in youth attendance, however, not to the same extent that we saw increases in invitations for youth. If the focus is on youth and family-centered meetings, this would indicate that not enough priority is being put on scheduling the meetings when the youth can attend. So while invitations increased, it is possible these meetings were not scheduled at a time convenient for the youth to actually attend. Turning next to parent, caregivers, and families, we found an increase over the course of the pilot period in invitations for the stakeholder group. And you can see at the end there, the last few months, we actually did hit 100% for invitations of this stakeholder group. Attendance, we did not hit 100%. We did see an increase over the course of the pilot period, though. Once again, as noted on the previous slide, if the focus is on youth and family-centered meetings, this would indicate that not enough priority is being put on scheduling the meetings when the youth's family member or caregiver can attend. Are the meetings being set at a time that's convenient for them? Turning next to our other stakeholder groups, behavioral health was invited to 72% of the meetings and attended 46% of the meetings that they were invited to. For the most part, these are our county behavioral health partners. Not a lot of contracted behavioral health providers were in attendance at these meetings. As Keisha mentioned, that's an ongoing focus of the project, but we didn't quite get there yet with the pilot. Both invitations and attendance increased for behavioral health stakeholders over the course of the pilot period. In fact, attendance increased from 0% in April of 2023 to 80% in September of 2024. Sustaining this increase in behavioral health participation in the monthly team case planning meetings will be critical as Delco continues to work to address the mental health and substance use needs of MSI youth. Attorneys were invited to 63% of meetings and attended 43% of the meetings they were invited to. Both invitations and attendance increased over the course of the pilot period for attorneys. And social workers from the Public Defender's Office were invited to 38% of meetings and attended 55% of the meetings they were invited to. Both invitations and attendance increased for public defender staff over the pilot period as well. Given the focused attention to youth safety and well-being that social workers offer, it will be important to ensure that social workers from the Public Defender's Office continue to be invited and attend the monthly team case planning meetings going forward. Turning next to education. Education representatives were invited to about half of the meetings and attended a little more than half of the meetings that they were invited to. In total, both invitations and attendance increased over the course of the pilot period. It should be noted, however, that while invitations increased in the two school districts with the most crossover in MSI youth, the proportion of educational representatives in those two school districts who attended the meetings decreased at the latter part of the pilot period from December 2023 through September of 2024. Representatives from the school district with the greatest proportion of crossover in MSI youth were invited to about half of the meetings and attended 37% of the meetings that they were invited to. Importantly, no academic improvement was recorded during either the pre-pilot or the pilot period during the 9 months following identification for youth who were enrolled in this school district. Now, you might question whether the youth enrolled in this school district were just achieving so well academically that there was no room for improvement. However, with crossover and MSI youth in this school district, they actually had a higher incidence, 56% had academic problems at the point of identification than in the total sample, which again was 44%. This suggests that the lack of improvement is not due to a lack of need for academic improvement in the school district. Contrast this to the school district with the second greatest proportion of crossover and MSI youth. They were also invited to approximately half of the meetings. However, they attended 63% of the meetings that they were invited to. And a greater proportion of crossover and MSI youth enrolled in this school district than in the full sample improved academically during the 9 months following identification. This data, combined with the prevalence of IEPs and academic problems in the crossover and MSI population, suggests that if there were more consistent invitations and attendance and a greater focus on academic outcomes at the meetings, then even greater improvement might occur. Additionally, in terms of case practice changes, we saw that a significantly smaller proportion of MSI youth were adjudicated delinquent for the referral closest to their identification date in the pilot period than in the pre-pilot period. During the course of the pilot program, Delaware County Juvenile Probation and District Attorney's Office made a concerted effort to increase the use of diversion opportunities, and this data suggests that MSI youth benefited from this initiative. However, although not statistically significant, the data does suggest that white non-Hispanic youth benefited more than Black non-Hispanic youth from this initiative. DELCO should review their criteria for diversion and its use across different racial groups to better understand why this benefit is not being universally felt. That concludes what's changed in terms of case practice, a brief overview. Next, I have 9-month outcomes and whether they have improved for the pilot youth as compared to the pre-pilot youth. We are running a little short on time, so I am going to skip over 2 slides, but they will be here for you to peruse later. So looking at that same measure of stable contact with parents or pro-social adults and involvement in pro-social programming or positive youth development activities, again, this was measured from both the perspective of juvenile justice and child welfare, and this measure is 9 months after being identified as crossover MSI, whereas the previous slide we discussed was at the point of identification. Child welfare reported a significantly lower proportion of pilot than pre-pilot youth had stable contact with parents or positive adults 9 months after identification. If we look at the first row on this table, though, we see that juvenile justice reported virtually no difference between the pre-pilot and the pilot periods. The lack of convergence suggests that perhaps a standard written definition for this data field could assist in measuring youth stable contact with their parents or pro-social adults as this work continues in DELCO. There was also a lack of convergence in the measurement of involvement in pro-social programming or positive youth development activities 9 months later. We see in the first row of the table that juvenile justice reported an increase between the pre-pilot and pilot periods, while child welfare reported a decrease. Neither of these changes was statistically significant, just where they're trending. Again, we've suggested to the DELCO leadership team that they create a standard written definition for this data field going forward. I do want to point out, though, that regardless of which system's perspective is being used, the proportion of crossover and MSI youth engaged in pro-social programming and positive youth development activities 9 months after identification is less than half. So this should be an area of focus as DELCO continues to work to refine their monthly meetings for this population. Turning next to school enrollment, we found that 88% of crossover and MSI youth were enrolled in school or an education program 9 months following their identification. And although not statistically significant, we did see a slight increase in school enrollment between the pre-pilot and the pilot periods. I do want to point out again that this is still alarmingly low for a population that are of compulsory school age. And as I mentioned earlier, approximately half of our crossover and MSI youth were enrolled in a different school or education program 9 months after identification. If we look between the pre-pilot and pilot periods, this does seem to be trending in the right direction. Again, this is not statistically significant difference, but we're moving in the right direction. The way this data was collected for the purpose of the pilot was a yes-no indicator. So we actually don't know if this change was towards greater educational stability or less educational stability. So in the future, the measurement for this field should change to provide additional context and learn more about what these changes are and why they're occurring. I'm going to skip over this slide in the interest of time. Looking next at child welfare, the proportion of crossover and MSI youth who had their dependency case closed within 9 months significantly increased between the pre-pilot and the pilot sample. And this was especially the case for MSI youth. If we look at the two rightmost columns in the chart, we see that pre-pilot MSI youth, 6% had their dependency case closed 9 months later, where in the pilot sample, 32% had their dependency case closed 9 months later. At the same time, there was no statistically significant change in the proportion of youth with additional child welfare involvement during the 9-month follow-up period. We saw this remarkable difference in case closure within 9 months of identification, particularly among the MSI youth. If this was being done in a rush, we'd expect a significant increase in additional child welfare involvement, but that's not what we saw. This is a pilot study, however, and so if we had tracked youth for 12, 18, or 24 months, we may see additional child welfare involvement. So this is something that Delco should keep an eye on going forward. While the data referenced earlier about case closure prior to crossover or MSI identification reflected a need for further exploration, the finding here refers to a later point in time, i.e. the 9 months following identification. Thus, while cases may have been or still are being closed too quickly prior to crossover MSI status, once the youth receives the MSI protocols, their child welfare cases appear to be closed out in a timely but effective manner. Finally, our behavioral health outcome. Approximately 30% of MSI youth had at least one emergency visit to a health provider during the 9 months following identification. Although not statistically significant, we did see an uptick in the pilot population, with a greater proportion of pilot MSI youth having at least one emergency visit to a health provider than the pre-pilot MSI population. The increase in emergency visits to a health provider during the pilot period appears to be a consequence of the pandemic and its aftermath. Behavioral health professionals indicated that due to provider staffing shortages since the pandemic, caregivers were taking youth to emergency rooms since they were stuck on wait list, awaiting the receipt of behavioral health services while in need of immediate attention. And finally, if any of you are going to be at the ACJS conference in Philadelphia in March, I welcome you to come stop by. Keisha and Melanie Govan and I will be presenting a little bit more on this project there. And I will turn it back over to Shay.
Thanks, Megan. And actually, you're not off the hook yet. I know we're going a little bit long, but I want you to go back to slide 45 and cover that material. I think one of the things that was really remarkable about what Delco did was to involve all the schools, having a list of school liaisons so that every child who came into this pilot, we would know which school to communicate with, be inviting them to the meetings, increase participation. I think some of these outcomes were a byproduct of their involvement. And during the panel, I'm sure Jeremy from Chichester School District will talk about this, but I wanted this data point not to be missed.
Okay, so just briefly, none of the differences in any of these outcomes was statistically significant. They are all trending in a positive direction, though. We saw greater satisfactory grade progression in the pilot youth than pre-pilot. We saw more pilot than pre-pilot youth improving academically. And we saw more pilot youth having a decrease in school discipline in the 9 months following identification. To Shay's point, though, these figures are still quite low if we just look at the proportion of youth. We would hope that a greater proportion than 56% had satisfactory grade progression.
Yeah, but as you said, trending in the right direction, which for a lot of these kids, education is an afterthought in terms of system involvement. So thanks for that, Megan. Thanks for a great presentation. Hopefully we'll have some questions that come up. It's a lot of data in a short period of time, but Meg will be available to everyone or anyone who wants to reach out to her to explore in more depth about the data that we found. So we're going to move on to the panel presentation. We're going to start with Melanie Govan and move on to Laura, then Gretchen, then Jeremy. Some of you may have noticed that Judge Kroll is back on the bench, so therefore she is not going to be able to be part of the panel. She did enter some of her thoughts into the chat box, so feel free there to take a look. But I'm going to turn to Melanie. We're going to structure this so that each panelist will have a couple of minutes to share their overall takeaways and thoughts about involvement in the MSI, what that experience was like, challenges, benefits, successes, and then we'll go into a cross-panel discussion. So Melanie, I'm going to hand it over to you. You're muted.
not muted.
Here we go.
There, good.
Yeah, we're good.
Thank you. Okay, good afternoon, everyone. I'm Melanie Govan, Delaware County Juvenile Court and Probation Services. So in Delaware County, we were able to build protocols for dealing with the multi-system youth involving those two pre-existing models that Shay talked about early on in the webinar. So we had been working with the system of care model and the shared case responsibility practice for several years. So we were able to use those two as the foundation moving forward. Now, that's not to say every county interested in doing this type of work should already have those collaboration models in place, but it's important to recognize where you are as a county, because your startup work may involve simply building relationships and cross-training with system partners before diving into procedures and protocol development. But the protocols were developed in Delaware County, and they identified specific steps for handling these cases with youth open simultaneously with the dependency system and the delinquency system. So there were several enhancements and changes to the collaboration efforts we had in place at the time. But as Meg and Keisha both emphasized, the most significant enhancement regarding collaboration among systems was the addition of the monthly team meetings. So the good news that COVID brought was we learned we could do these things virtually. So we were able to hold in-person meetings if that worked best for the team and the family versus virtual meetings if that worked better. And there were even meetings that were a hybrid version of those. So the MSI protocols were implemented in April of 2023. So around that time, Delaware County was facing some other challenges that really impacted system collaboration. So for one, our local detention center had closed in 2021. So as my colleagues in Pennsylvania know, detention beds became almost impossible to find around that time. So probation officers had to develop plans that were completely outside the box and involved a level of intense monitoring that we feared was not enough to keep the child and the community safe. So the enhanced collaboration of the MSI protocols allowed probation staff to collaborate fully with other system partners and help them understand our limitations and pool our resources. At the same time we were dealing with that, CYS was dealing with severe understaffing, the mental health system was dealing with long wait lists resulting from COVID, and the schools were navigating this return to in-person learning after the major disruption that COVID caused. So the team approach helped ease the comfort level of some system partners at times because planning was a group effort, and again, resources could be pooled. With this, some system partners recognized that they had to do more because another system was at a loss. In some cases, this strengthened relationships among system partners, but in other cases, it did cause tension that took some time to reset. So in the end, I think I'm saying we probably would never have implemented this multi-system work if we kind of waited for a good time to do it. It was likely that there was never going to be a time that all four systems felt stable and ready to implement changes. But what we did was we worked slowly and we had sternly to keep us on track and accountable. So a final thought, a lesson learned is that you heard Meg talk about, and you'll see in the final report, that one of the things that increased over time was the fidelity to the protocols. So the meetings, we had the specific plan in place for who would be invited to a meeting, when the meetings would occur, and fidelity to that direction increased over time, which surprised me because I thought we gave, very specific and clear what should we do. But in hindsight, I'm learning that we likely needed more intensive and consistent training, specifically on the topic of effective meeting facilitation. So probation officers are identified in the protocols as the facilitators of the monthly meetings. Although a meeting guide was developed and distributed, I overestimated our staff's comfort level in those types of situations. So once the monthly meetings began occurring, I recognized that many of our probation officers, especially the newer staff, felt intimidated by the pressure of having to keep order in this unpredictable conversation among, 5 to 10 people. So many of the POs also felt overwhelmed by having to kind of wear two hats, so to speak. So they were a meeting facilitator and a participant. We're adjusting now and we're working with our staff to develop their facilitation skills. But if I had it to do over again, it might have been worthwhile to identify a contracted provider or other party to facilitate the meetings, or maybe even shuffle duties within our department and specially train a handful of staff to facilitate these meetings. So I'll stop. Lots to say about the entire project, and it was a really positive experience, but I'm going to pass it over to Laura Keebler from our county's Office of Mental Health to share her thoughts from the perspective of the behavioral health system.
Thanks, Melanie. Hello, everybody again. My name is Laura Keebler. I am the System of Care and Children's Mental Health Coordinator. As Melanie said, there was a lot of things going on in the beginning of the pilot. There was also a change of leadership in a lot of our departments going on. We changed MCOs after 25 years. So our managed care organization changed after 25 years. We were coming out of the pandemic, and anybody who's been involved anywhere near the mental health system knows that our staffing levels were really, really, really tough. When I first saw the application for the pilot program, I was so excited. I ran over to my supervisor and said, we need to do this, because I had come from the child welfare world for many, many years and came back to mental health not that long before the pilot, and really remembered those, 4:00 in the Friday afternoon crisis meetings that we always had to do. And I knew that our systems wanted to talk to each other, but as Melanie said, there was days where we didn't even want to talk to each other because there were so many conflicts with so many kids and just looking for resources every day. I did not have all the relationships. My predecessor had been in my role for 15 years, so she had a lot more relationships than I did. So I learned a lot. I learned, all the different judges, who did what. And I encourage anybody who wants to do any type of cross system to really, really understand your players and understand the roles of your system. We had started this process way before any of these things. Like Melanie said, we were doing shared case responsibility starting in 2010. We brought our close relationship with the school districts got a lot closer in 2015 when the Every Student Succeed Act process started. And we have been a system of care county since 2014. And we were really, really trying to endorse all of the system of care principles. But one of the things that I found that was challenging is trying to help everybody understand, not just the administrators, but on the caseworker levels or the therapist levels for all the providers, or even our MCO, of why this work was so important and why these relationships are so important. I think everybody understands it on a basic human level, but really putting the time in. I appreciate Shay and Meg's work and really, really keeping us consistent. Really quickly, really funny, Keisha was literally a 30-second, hey, do you want to be part of this program, this pilot thing conversation? And she was willing, little did she know, jumping into this, she was going to have to do so much work, and I truly appreciate it. But yes, having those relationships and understanding that every county, every group is on a journey, and we just happen to get really good timing in a lot of changes and a lot of goods and bads, but we happen to have a really, really good timing. Moving forward, I being on a lot of the MSI meetings, I know it's a lot of younger caseworkers, new supervisors, and we know that in order to facilitate a meeting, it just takes a lot of practice. So I think there's going to be a lot of one-on-one work that we kind of need to do. I was hoping my mental health providers had stepped up a little bit more, so I'm going to work with them. But that was my overall take, is that we have a lot of work. We knew we had a lot of work to do. This taught us that we have a lot more work to do, but it was a great collaboration all the way through. I'm now going to hand it over to Gretchen Sidler.
Good afternoon. I'm Gretchen Sidler. I'm the Deputy Administrator here at Delaware County Children Youth Services. Yeah, I mean, as Melanie said, we were in a really bad place at the time that we decided to take this on. So I'm just really grateful that all the partners here were like, come on, we can do this. It's important for the county. It's important for the children and family that we serve. And it was a really good experience. MSI youth that are identified are a pretty small portion of the referrals and active cases that we work on, but they are some of the most complex cases that we work on. And so, really putting the work in to develop the relationships, to make sure that these meetings are happening, that there's good communication going back and forth, has gone a really, really long way. To include that we used to have a lot of things escalate to administrators because there just was a lot of conflict. People didn't really understand each other's systems. They weren't in agreement going into court. The court was wondering what was happening. And so these cases would escalate. And we have seen a huge decrease in the escalations of those cases. It does appear like the work is being done in the meetings. There's communication, and they're ready to walk into the courtroom, which is, I guess, leads to the other piece that I thought was a big bonus of the way that we rolled this out, was that we really did incorporate the judges that we were working with into writing the protocols, making sure that they were on the leadership team as we went through. And it really made an important part of this work that we were doing. As Melanie had noted, we had been doing SER. We had been collaborating CYS and JPO for a really long time, but did not involve the judge at that point. And so we would often go into each other's courtrooms, and I think the judge didn't even really understand why we were there or what we could offer. So this really was a very holistic way to look at it. And I think both of our systems felt much more respected in each other's courtrooms and what they could bring to the table, since the judge was acknowledging us and asking for opinions. I think the challenges that, still are there for us, for CYS, again, we have all these priorities and we need to retrain on MSI, and that's not really happened. And we need to kind of figure out how to fit that into the rest of the priorities that we have. And parent-child involvement is a huge one that I think is on our agenda. The cases that we have identified where parent-child involvement happened in these meetings on a monthly basis, the outcomes were so much better. I think that's, everyone can see that would be the case, but it's a hard process to get everyone to the table, and we need to do better work at making sure that happens. We do have, if you read through the protocols, we do have quarterly meetings of our leadership team. So these areas that have been identified in the report, as well as things that we've identified, is something that we then are working through on a quarterly basis to try to kind of figure out how to move everything forward. And then I'm going to hand this off to Jeremy Curtis, who is our school district partner.
Good afternoon, everybody. I'm Jeremy Curtis. I'm one of the assistant superintendents in the Chichester School District. So 3 years ago, we were asked to be a part of this process and this pilot, and we're always looking to make better connections with our Delaware County partners. So we agreed to be a part of it, and I'm truly happy that we did. I wasn't really sure what to expect from this pilot process when we first joined in, but it really has been super beneficial for the school district. So as one of the top end leaders in the school district, it has helped me get to know a bunch of the partners in Delaware County. I've been in other meetings with other topics with Lauren, Melanie, Keisha, and Gretchen. And some of my staff will come and say, hey, there's an issue. Well, I know somebody in that department because I've gotten to know these folks so well over the past few years. So that's for me at the top end. From my social workers and school counselors, they weren't quite sure what to expect, but they knew that it was probably going to be a positive outcome, because we always want to get more involved with our community partners. Some of them have those relationships, but this has just amplified those relationships to a higher degree. These are some of our most complex and challenging students that we have in our school district. So when you have a student who comes in and they seem to be agitated or frustrated, a lot of times our counselors will get a call and say, hey, this is what happened last night. Be prepared for this. The students come in with this, because of those relationships and connections that they have built through this process. It really does, for the school districts, it really does continue to make that circle of care around these students, where the students know that our folks have relationships with the people that, with the professionals that are working with them outside of school hours. And I think that's why you have seen that positive trend of academics a decline in behavioral issues, better behavior for the students, is because they know that there really is a group of people who care about them, who are working for their best interest, who are communicating well, and who, really have been able to work together for the benefit and betterment of these students. So, the outcome has been great. Our counselors are very excited about this process. In the past, we've had similar type of meetings with community partners and county partners, but it's really great to see an intentional focus on getting the whole team together and bringing our team together for, again, the betterment of our students. So one of the things I wanted to mention, I kind of mentioned it briefly, but we had a specific student who was part of this process, who was really having some issues the evening prior. That morning, one of our county partners was able to call the school counselor and report, this is what happened yesterday. These are some of the things that we're working on. And then my team was able to discuss that and break it down at the beginning of the school day, help process some of the stuff that happened, and then help reinforce what our partners in Save Children and Youth wanted to work on with that student. So again, that connection plays out in a very real sense for our students and our staff. So yeah, I would recommend any of you who are trying to get this going, reach out to your school partners and let them know it's going to be nothing but positives for them and their staff as a part of this process.
Thank you, Jeremy. Thanks to all of you. It's unfortunate Judge Krull couldn't also be part of the discussion, but I think the four of you really covered a lot of good territory in terms of the multi-systems perspective on doing something like this. Judge Krull's comments, it's a limited version of them, I had a couple prep calls with her before the webinar, are captured in the chat. But what I would add to what she's saying here, based on my conversation with her and prior experience in working in this type of effort under the crossover youth practice model and now the multi-system integration, is how critically important the judicial role is. To have judge buy-in, the judge should be at the table and not walk away from the table after day one and delegate to someone else, was important. Judge Lowe kicked this work off in Delaware County. He was a constant presence and reminder that we can do better at how we do this work, and provided some accountability in the process by always being in the room or on the calls unless he was called to an emergency on the bench. And then Judge Krull took over and just didn't miss a beat in terms of immediately understanding the importance of this and making sure that it came to fruition in a positive way. So I think her advice in the chat was to make sure that your judge is involved from the beginning. And then also, as I've added, isn't just there as a ceremonial day one, we're involved in this, let's support it, and then doesn't show up again. I think it's critically important that the judge maintain their involvement all the way through, which is what we've seen in Delco. So I want to get into some questions and some cross-panel discussion. And again, the main focus of today is on data. So I wanted to go back to the data. And I'll put you a little bit on the spot, although you did have a preview that I might get into this question. When you look at the data findings, the data points, what most impressed you and what most concerns you in terms of the outcomes you saw in the 9-month data? Was there anything that jumped out at you and said, okay, so we clearly have a problem here, or wow, 9 months later, we really have improved in one area or another? And so I want to just kick that off, and anyone who wants to jump in with their observation on that, go ahead and do so.
I can throw out a thought.
Yeah, thanks, Keisha.
I would say I don't necessarily have concerns, but I think there is an opportunity that is presenting itself here in terms of the overrepresentation of certain groups. That kind of alludes to the fact that we have an opportunity to try to build in cultural competency training to learn more about the experience of these particular populations, and just learn, more how to engage these youth and families in a way that is culturally sensitive and improves outcomes for them. So that was just one of the areas that I felt was an opportunity, a really good opportunity for us.
Yeah, I would
And-
join in.
Yeah, go ahead, Jeremy.
Sorry,
Okay,
I would agree with Keisha. The overrepresentation is definitely a concern for me from the school district side, and that's something that we continue to address with cultural competency and some of our diversity work. But then on the bright side, I feel like overall we have seen a positive trend in the right direction with some of the relationships, some of the engagement, and some of the growth of the students.
Yeah, and I think we saw some decrease in school behavior issues over the course from pre-pilot to pilot, which was helpful. I think from the disproportionality perspective, I think looking at the data, which you all are, but in a county that is going to undertake something like this, to say, okay, if our children of color, our Black children, our brown children are not experiencing the system the same way other kids are, then why is that? And how do we alter that? If school discipline has been meted out more harshly to kids of color, why is that? What do we need to do differently in that regard? Even what Meg pointed out in terms of the diversion opportunities, is there something we need to do differently in terms of criteria that might enhance the experience in a good way, still respecting public safety, that might still get us to better outcomes? I don't know, Melanie, if you have a thought about that. On mute.
I actually, of course, agree with all of that and the concerning nature of it. I'm stuck bothered that the kids have such limited pro-social involvement, activities, those types of things. So that's been sticking with me for the past few weeks. And I know not everybody's good at sports. So it's like, this is a good group to get, our brains going on what other things kids could be engaged in. And that's something that I would like to spend some focus on moving forward.
Yeah, the parent, like the lack of pro-social, the lack of parents, and youth in the meetings, and the age of the youth coming into identified as MSI, kind of have me go back to Shay, the prevention cultural work group that we tried to get started and didn't quite come together due to a lot of different factors, and really looking at that upstream work that we really need to do.
Yeah, I mean, I think if I'm going to focus on a couple of the main areas that I want to see, I personally and professionally want to see change for these kids, it's the greater focus on educational outcomes. But sometimes that's an afterthought. It shouldn't be. It certainly isn't in federal legislation, but an afterthought in terms of case planning when you're thinking about, is this child safe? Are they in a more permanent setting? Education is teed up as a third issue to be talking about. And then the pro-social development and the different system perspective on that. So in our research here with your site, juvenile justice saw pro-social programming go up from 30% to 47.8% pre-pilot to pilot, but in the child welfare side, down from 20 to 13.6%. And that might just be the nature of the exigency, Gretchen, of a child who's been abused and neglected and getting them safe and in a permanent setting, as opposed to thinking about that third dimension. But it's something where if we're doing the work collaboratively and across systems, the system partners can sit at the table and say, let's not walk away from the table before we talk about education. Let's figure out what the hobbies are, the interests are of this child to give them a pro-social opportunity. So the normal positive youth development arc that we want to see isn't lost. I think that's an important dimension.
Yeah,
Gretchen?
and I don't know that Melanie talked about this specifically, but kind of at the same time this was all happening, they were looking at really trying to help kids move into diversionary programs and to not have to adjudicate. So I think this team approach was like, let's identify what are the things we can wrap around them so they're successful at diversion so it doesn't happen. So I think that kind of plays into that whole piece about looking at pro-social.
I agree. Okay, real quick question. Then I want to get ready for Stone to come back online with Ronnie and give us some comments. So one of the key things I hear from places that think about doing multi-system work or crossover type work is the increased information sharing. That if we do share more information, sometimes it's going to be used to the detriment of the child and family as opposed to the benefit of the child and the family. And we spent a lot of time in Delco talking about how would this information be shared, for what purposes, if there was a privacy interest, the need for a consent to sharing information, making sure it was an informed consent. the parents understood how the information was going to be used, who it was going to be shared with, for what purpose, and how long, and that they had a right to cut it off at any moment in time. How did you experience the enhanced information sharing in Delco? And did you feel that it was worth the risk and that we didn't see a downside in terms of that harmful use of the information?
So I can jump in. I think the fact that our administration was able to reach out to a lawyer that specifically looked at HIPAA as the highest level of confidentiality and based the information sharing on that. And then kind of going back to, okay, we can only share, we can early identify based on health and safety, but we can only share claims data. We weren't sharing any clinical data, anything like that from the mental health world. And I think a lot of times when we do have those parents and those caregivers and those youth on those meetings, to be able to say, are you comfortable with me sharing this information with the next person on this meeting? Are you comfortable with this person being at this meeting? And really just hearing it live and in front of them. Not, obviously releases are done, but just having that, giving them the opportunity to say, this is why we're having this conversation. Are you comfortable with us sharing this information?
Yeah, and if I could piggyback on that really quickly, Shay, I think the families appreciated the fact that they didn't have to repeat some things 4, 5, and 6 times, that they shared it with a member of the team or they shared it during a meeting, and all were then aware and didn't and knew about it and considered it in their next move.
That's a really a key point. And I think, in line with that, Melanie, even just an overall effort like this, if you're undertaking it, you're being to identify the gaps and to be able to talk to parents and children and say, we're looking at doing this differently. What do you think we need to change in how it's done? And as we've done that previously at the Center at Georgetown, one of the things we hear from them often is multiple meetings, repetition of information, disrespect of our time, not coordinating where we need to be and when we need to be there. And instead, we are in multiple places, multiple days of the week. And I think you actually have helped to reduce that significantly in Delco with the way you set up the meetings. So again, thanks to the panel. Thanks to Meg and Keisha for a wonderful data presentation. There is a final report that was issued on the Delco site. And I think either at the Stoneleigh website or at Georgetown, you'll be able to find that. You also will receive, and this is something that might be covered in a minute or two, information on this webinar and a link to it in the days to come. But Ronnie Bloom is not able to log on for technical reasons. And so Anne Marie is going to kick back in again and do our concluding comments from the Stoneleigh Foundation.
Thank you so much, Shay. I'm really delighted to express our thanks on behalf of Ronnie, on behalf of the Foundation's staff and board. I'd like to thank everyone who participated in today's webinar for your leadership, your commitment to really groundbreaking work in Pennsylvania and in Delaware County in particular. When our Stoneleigh Fellow Shay Bilchek embarked on his fellowship work 5 years ago, we knew that he had the expertise, the experience, and the relationships to catalyze real change within and across our youth serving systems of care. And it's clear from today's conversation that he had tremendous partners in this work at the county level. Our thanks to Jeremy, Melanie, Judge Kroll, who expressed her remarks in the chat, Laura and Gretchen for your continued collaboration and for sharing your insights today. Here at Stoneleigh, we are committed to evidence-informed decision-making, and so we deeply appreciate the work of our former Emerging Leader Fellow, Dr. Meg Ogle, and Delaware County's Keisha Brown for your detailed data presentation. And finally, I'd like to thank our partners in this work and the co-hosts of today's webinar, Georgetown University's Center for Youth Justice and Michael Ampierre. Stoneleigh will, as Shay mentioned, be sharing various materials, including the recording of today's webinar with all of the registrants for today's event. So we encourage you to view those materials and share them with those who may not have been able to participate. And our next webinar will take place on Tuesday, December 2nd. It will address how the practice of restorative justice serves survivors, youth, and communities. We encourage you to register and to join us for that discussion at stoneleyfoundation.org/events. And you can also find information about our fellowship model on our website for those who may be interested. With that, I'd like to thank everyone in our audience for tuning in today, and we hope to see you at our next event.